is Chioma Sullivan, and this is my Pne Lab video number 2. Before I start, I'm going to be doing a 360 view of the room. Alright, so before I begin, I will perform hand hygiene and don a pair of gloves. Now that my gloves are donned, I will then be taking an alcoholic wipe and sanitizing my stethoscope. Now we move on to the patient introduction. Hello, Mr. Smith. My name is Chioma Sullivan. I am your student nurse today, and today we will be doing a physical assessment. Before we begin, I'm just going to ask to see your ID band. Alright, can you confirm your first and last name for me?
John Smith.
And your date of birth?
1st of April 1973.
Alright, perfect. Before we begin, I'm just going to ask, are you comfortable?
Yes.
Do you need to use the restroom?
No.
Alright, perfect. So I'm just going to pull back the curtain for an extra sense of privacy. We're going to begin the assessment now, and we're going to start with the ears. So the ears are even bilaterally, they're symmetrical, and there's no discharge. I'm then going to palpate the auricle and tragus. So as I palpate, there's no tenderness?
No.
No pain?
No.
Alright, perfect. We're now going to move on to the whisper test. I'm going to whisper 3 words in each side of your ears, and you're going to repeat them back to me, okay?
Peter Pepper Pig. Pencil, paper, plastic.
Alright, perfect. Now we're going to move on to inspecting the nose. So the nose is midline, and there's no discharge. Then I'm going to palpate the maxillary and frontal sinuses. So as I palpate, is there any pain?
No.
Any tenderness?
No.
Alright, once again, any pain?
No.
Any tenderness?
No.
Alright, perfect. Next thing we're going to do is inspect the mouth. So I'm going to start with the lips. So the lips are hydrated and there's no swelling. I'm going to ask you to open up for me. Right, so the gums are pink in color. There's no bleeding. The teeth are evenly distributed and there's no looseness. The tongue is symmetrical and there's no signs of atrophy. I'm going to ask you to touch the tip of your tongue to the top of your mouth for me. Alright, so the base of the tongue is hydrated and there is no lesions. I ask you to relax your tongue. Open up for me. Alright, perfect. So the soft and hard palate are intact and there's no signs of lesions. Next thing we're going to do is test the cranial nerve number 9 and 10. This is your glossopharyngeal and your vagus nerve. I'm going to ask you to say ah. So when the patient says ah, the soft palate and the uvula is rising up and back. So this means that the cranial nerve number 9 and 10 are working correctly. We're now going to move on to testing the cranial nerve number 11. This is your hypoglossal nerve. I'm going to ask you to open up for me. So the tongue is midline. I'm going to ask you to move it side to side. Alright, perfect. I'm going to ask you to repeat these words. Light, tight, dynamite.
Light, tight, dynamite.
Alright, perfect. So there's no signs of tremors. We're now going to move on to inspecting the neck. So as I inspect the neck, the head position is centered in midline. There's no scars, there's no lesions, and the skin color matches with patient's genetic background. I'm then going to palpate the neck. So as I palpate, there's no tenderness, right? There's no pain.
No.
Okay, perfect. The temperature is warm, and there's no visible masses. And I'm going to palpate the carotid arteries. So as I palpate, the grade strength is +2. The rhythm is regular. The other side, the equality is even bilaterally on both sides. Now I'm going to move on to inspecting the cranial nerve number 12. This is your spinal accessory. I'm going to ask you to turn your head to the left and the right, and I'm going to apply resistance, okay? So we're going to start with this side. Alright, perfect. And other side. Okay, perfect. We're gonna do the same thing with your shoulders. I'm gonna apply resistance and you're gonna shrug your shoulders, okay? So, all right, perfect. Now we are going to move on to inspecting the upper extremities. So I'm gonna ask you to roll up your sleeves for me. So as I inspect the upper extremities, there's no scars, there's no lesions, there's no deformities, and there's no involuntary movement. I'm then going to palpate the upper extremities. So as I palpate, there's no pain, no tenderness. All right, there's no lesions or masses. The temperature is warm, and so the temperature is warm, and there's no swelling. Okay, so you may pull back down your sleeves. We're now going to move on to inspecting the fingers. Can I please see your hands? So the nails are rounded and smooth, and there's no lesions. All right, perfect. You may put your hands down. We're now going to move on to doing range of motion activities. May I ask you to stand? So I will be doing some range of motion activities, and you are just going to be mimicking my activities. So flex your fingers, extend your fingers, flex your wrist, extend your wrist, ulnar deviation, radial deviation, flex your elbows, extend your elbows, pronation, supine, adduct, and abduct. Okay, shrug your shoulders. Okay, perfect. Internal rotation, external rotation. All right, perfect. You may have a seat. Did you have any pain while performing these activities?
No.
All right, perfect. So there's no signs of pain, there's no altered range of motion, and there's no signs of crepitus. The next thing I will be doing is inspecting, palpating, and auscultating the posterior thorax. And ask you to turn around for me and raise the back of your shirt. So as I inspect the posterior thorax, there's no scars, there's no lesions. Skin color matches patient's genetic background, and it is symmetrical. I'm then going to palpate the area. As I palpate, is there any tenderness?
No.
Any pain?
No.
So there is no masses or lesions. The skin temperature is warm. Next, I'm going to auscultate the area. All right, perfect. So as I auscultate the area, there was no wheezing and there was no crackling sounds. You may pull down your shirt and turn back around. We're now going to be doing the anterior posterior ratio. So for the anterior posterior ratio, it's a 1, and the transfer is going to be a 2. All right, so the ratio is a 1 to 2 ratio. I'm then going to palpate the anterior thorax, and ask you to raise the front of your shirt for me. All right, perfect. So the rate, the breaths per minute, is 14 breaths per minute. The rhythm is regular, and the qualities of the respiration is smooth, even, and effortless. Thank you, Mr. Smith, for your time. And this is the end of the assessment.